14th. Bob, will you give us the invocation?
Lord, we are grateful to be here to discuss the business of the county, to do those things that are right in your sight. Lord, help us hold to your word and let our lives mirror the effect of Christianity so that we are examples to others. Give us wisdom while we debate about these things, that we do the right thing for the citizen of this county and the employees of this county. We ask this in your Son's name, Jesus Christ. Amen.
So if everybody has an agenda, can I get a motion to approve the agenda?
Can you add that one item under old business?
Yes. Oh, yes. So we need to add one item under old business. So we'd like to add termination of benefits at the end of employment to be discussed under old business. Thank you.
That's the one that never, so,
Can I get a motion?
So moved.
I so move. I second. All right, so now can we approve the agenda?
Yes.
So move to. And we move on to recognition of the public. Did anyone want to speak? We don't have a sign-up sheet, but if anyone would like to speak. So we move on to approval of the minutes. I so move that we approve the minutes.
So moved. Second.
Minutes approved. We have 2 minutes that we're approving, January 17th and February 23rd. I so move. Report of the committee chairman. I have no report. Report of the consultant.
Let me begin by saying that Brittany could not be here today. She had a doctor's appointment this morning with her cancer treatment. And hopefully she will be released to do regular activity with that visit this morning. So thank you for your thoughts and prayers. And so what I have, what you have in front of you is the monthly report regarding your medical and RX and dental, and a per employee per month graph on the clinic. And a lot of what I'm going to tell you this morning was dictated to me. So I do have knowledge of this. She and I have spent 2 or 3 hours going over this information, so for her to make me aware of it. She has not been limited on thinking or typing or entering into computer, whatever you call that nowadays. She still does it very well and is sharp as a tack and very positive in her treatment. On this monthly report, she reported that everything is running in the black for this month. Items of note are that the county received a sizable rebate, an RX rebate. These are received approximately every quarter and based on retail drug filled through the plan. This rebate was $155,000, $521.43. And she says, as we reach the end of the plan year, it becomes evident on the graph that this year is tracking better than last year, thankfully. Our goal is to flatten the increases, and this year has been successful in doing so. There are 2 new large losses, but these are both only $8,000 over the $100,000 level that she watches very closely. And of course, we will begin in July looking at those again, so they will start over. So it's unlikely that those, from what she's seen on prognosis reports, that they will do anything, if at all, before July. So having said that, it looks like that for the year, I won't read these numbers to you. It's simply, again, the graph shows you what happened in the month, how much income came in from various sources, and how much went out for the medical and the dental. And then the large losses track below. And at the very bottom left-hand side, the running stop loss fund, where you stopped buying stop loss and started booking that premium into a fund in case you do need other money, is at $805,687. And the prior year's county stop loss fund was $618,580. So it's grown proportionate to that. The dental is likewise tracking well, and you can see that we had a spike last year in that blue line lower right-hand corner on the line graph. We had a really bad year last year, and so we've told you before, if you look at a 10 to 15 year spread of your claims, on average, every third year, you're gonna have issues. And that's why we have this plan like we do, to help us level out those large spikes. And that's why your reserve that David can report to you later is there, in addition to this $805,000, in case you do need to pay some unexpected, very large claims. And that has allowed this plan to work very well. Are there any questions on this information? Yes, sir.
Why is there a spike every third year? I mean, you said that was just kind of a matter of fact.
Right, it's on average. It's important that we look at that. It's not like we can anticipate it. You may have two in a row, okay? But if you look at linear at your claims, it's just laws of averages. But into that, you've got to factor the mix of male, female, those kinds of things. Age has something to do with it. For instance, in schools, you have a larger propensity for pregnancies. And if you do, then you've got a larger chance you're gonna have some pretty serious claims there. So there's different things you can look at to kind of anticipate. And then the other thing we do in cooperation with Blue Cross is to follow these large claims, or ones that could potentially become large claims, and monitor that prognosis and try to help those individuals get the care they need, and to help them manage those diseases. So we're involved with them and trying to.
An actuary.
COVID's gonna skew your trends some too. COVID-19 skewed those trends around a lot with all that testing and stuff going on. So
Right.
that was kind of a bad effect.
So is that what we're seeing with the dental? People didn't go to the dentist during the shutdown, and then they went?
Yes, there was obviously, that would have been a bad COVID situation. Dentist and a patient just right here breathing at each other. So people I'll just put that off.
Still, your dental's still down. I mean,
Oh, yeah.
it's not gonna increase in cost in a couple of years now.
I mean, this is not very large.
Yeah,
The spread isn't.
Well, your dental's pretty much been flat. That's what we'll talk about rates later, but it's been flat for 3 or 4 years now, Bob.
Yeah, and the actuaries have said that, you know.
Mm-hmm.
Flat to negative, actually.
Yeah, yeah.
No one's driving for sure.
Any other questions on this report?
No,
It's good
thank
news.
you. It looks like good news.
Yes,
Interest rates up is good news.
yes, and I have some other things, but they're further down the agenda.
Excellent. So 1-to-1?
In the agenda, it had, I think it was the Q4 numbers, so I did go ahead and bring Q1 since it's passed. That way we can kind of look at the comparison on those two.
Thank you.
Thank you.
All right, so from a clinic utilization standpoint, got the facility there. Again, Schaefer, one of our top utilized clinics, because you had a big number of telehealth visits when you look compared to the agenda items. There were 127 telehealth visits for Q4, a little bit of a jump to 182 in Q1. With the top clinic visit types, walk-ins and sick visits, which are going to account for your urgent visits, your needing treatment urgently, missing out on those other walk-in clinics that are available out there, utilizing the one-to-one clinics, had a total of 292 of those visits in Q1. of this year. Telehealth, again, another top visit type. And then behavioral health had a total of 114 for Q1. I know last time during the meeting, you guys had asked kind of how many patients that represented. So it's a total of 47 patients for Q1 on that behavioral health perspective. And then patient satisfaction with overall satisfied or very satisfied with overall clinic experience at 99.2%. And then from a wellness perspective, had 394 employees and 180 spouses who were compliant for this last wellness program. If you flip over to that backside, you've got some information about the new wellness program that rolls out with some important dates down there at the bottom with the HRA events and locations. So during that weekend, August the 14th through the 18th, have 5 different locations with times where we'll hold those HRA events.
At the HRA events, so an employee walks in, what services do they?
So we get their biometric screening, height, weight, blood pressure. We also go ahead and do the lab draws while they're there as well.
And they get a nice little chart to take home, or? When I do that, I have a similar plan with Quest, and they send me a nice little chart that tells me everything.
As
So
far as
I'm
what
just
the-
asking, yeah,
what the
what my,
results are.
yeah.
I believe that those are posted to your portal.
Yeah, we get it.
They go to the portal.
So
Perfect.
we physically send off the blood and it takes like 3 days to get it back, so we don't have, it's not like finger stick, we don't have instant results.
Yeah,
They recommend physical too, but I think for employee convenience, the committees continue to do the HRAs because they're recommended from the physicians and the most associations that do a full-blown physical.
Right, and we've had, it's been a gradual process, so over the years, every year, a few more folks join the physical side of things instead of going through the biometric screening at their work location. Obviously, physicals, if they're more in-depth, we can talk about whether you've had your mammogram and your colonoscopy and your routine vaccinations, things that you can't get through just a quick biometric screening.
On your wellness chart here, what is the percentage of compliance?
The percentage.
Yeah.
I don't have that off the
Okay.
top of my head, but I can definitely get that and send that over to you.
And also the other thing here is you have 2023 program again, so that's just the next time it starts, okay?
Yes.
Well, we don't know, but I believe it's in the 70 to 80 range,
70 days.
just based on the amount of people that we have on non-preferred, and I can't recall off the top of my head, but a lot of them's actually to do with, a lot of your non-compliance is to do with nicotine too.
Yeah.
So if they don't have,
I'm just kind of wondering.
if they don't pass the nicotine, a lot of people won't take the physical at all.
Yeah.
So that's where we kind of end up right now. There's no incentive to take the physical if you're nicotine non-compliant. I believe it's 780, but they can check and tell us.
thank you. So we move on to the report of the finance director.
What about under old business?
Well,
That was the one item you want to do.
yeah, do you want to,
Oh, I'm sorry,
it?
report of the, I'm looking at that.
That's okay.
Sorry, I'm getting all backwards today.
No worries.
It's on page 18 through 22, if we can turn to page 18. And this is where your financials, and I'll go over some of the highlights really quickly. Make sure I stay on the agenda, I'm moving down too quick. When everybody's there, just let me know.
We're good.
Okay. If you look at your cash situation, you're about 17, almost $0.6 million in your actual self-insurance health insurance fund, and you have runoff claims that will have to come out of that. And last year they were estimated at a little over $1 million, so you're probably looking at $1.3 million. So you have a net of 15 plus million, 15, 16 million mark easy, which is a nice, strong, healthy reserves for your runoff claims. But if we go to page 19 and 20, this kind of shows you really easy. And if you look at I think it's actually the fourth column over, and it'll say on page 19, actual year-to-date revenue. And if you go to the next one, it'll say year-to-date expended. If you go to the very bottom numbers, and these are the two numbers to compare if you just kind of put them beside each other. Same thing that Bob showed you earlier. You have a little over $8.8 million worth of revenue and a little over $7.1 million worth of expenses. So this year, and you'll see it later on your insurance rate premiums, you've tracked much, or your increase is much better than last year. One of my opinions, I think Blue Cross would probably agree, is COVID interfered significantly with a lot of your claims the last couple of years. I think it's subsiding somewhat or greatly, which has helped this particular trend. But your health insurance fund trending well. We'll talk about the insurance rates, but this pretty much parallels Bob. Over on your dental, which is on page 21. If you look, you have the very top number on the right. You have about a little over $1.2 million worth of cash. And your runoff claims last year were estimated 22.9, probably pretty close to the same this year. So you have a nice strong reserve. If you go over to the next two pages, 22 and 23, it's the same financial statements for your dental. So the fourth column coming from your left, which is your, this is actual year-to-date revenue and actual year-to-date expense. If you look at your revenues, you're about $340,000. Your expense about a little under $260,000, so you're looking at about $80,000 positive sway. And when you get to your premiums, you'll be positively surprised with those two. They're very good, the increases. Does anybody have any questions of where we're at on the financials?
Just one thing, on 22, I noticed it's got percentage collected at the very
22, yes, sir.
right there, so we just,
That's just through March.
okay.
So yeah, we're anticipating we'll collect somewhere around 100% on these.
Okay.
It'll give and take based on your number of participants, which will go up and down. So the expense and the revenues will offset. We track the cost per employee. So right now we've got a very positive trend. We were expecting it to subside somewhat around January, but it's held fairly consistent through most of this year. That's why you've got such a low increase next year. And I think that's because a lot of the COVID costs have dissipated or somewhat dissipated, is my theory. But Blue Cross may have a different theory, but we had a good year. We had a good premium increase. It's very low. Unless they have something different that they think's the reason. But, does anybody have any questions? And that's the end of my report, Mr. Chairman.
Thank you. So we move on to new business. The first item is the fiscal year 2024 insurance rates.
No, you mean our old business?
I'm sorry, old business. We can't get this one in, can we?
He got left off old business too.
I know.
Let me
Yes,
tell you-
old business, termination of benefits.
Let me read to you what the EOC actually states on termination of benefits. When you quit, it says termination of coverage due to loss of eligibility, which would be when you're terminated. It says your coverage will terminate if you do not continue to meet the eligibility requirements agreed to you by the employer and administrator during the term of the ASA. Coverage for a member who has lost his or her eligibility shall automatically terminate on 12 midnight on the day of the loss of eligibility. That has never been, this has been in here probably since before I was here quite a bit, and that's never been what the county does. So that's why I keep bringing it up. We really need to align those, but when we do, we've got a couple issues here, and these are the issues we run into. Historically, what we've tried to do is if you make the first payroll, we try to pick up your second payment, and even though this doesn't say always run you to the end of the month. The problem we've got is if we're not notified in time, we do not pick up that second premium. What we've done historically is we call the employee, and the employee will bring quickly the second payment and or say it's not important to them, and we'll back them up to the date of termination according to this. Lately, we've had one where we couldn't get a hold of them at all, so we actually backed them up based on the EOC. My concern is right now we run into several of those was we need to actually align one way or the other what we're doing to the EOC, or we need to change the EOC to what we're doing, or we need to align back to the EOC, one or the other. But we need to start terminating the day of the last day of coverage, or we need to change the EOC to state something to what we're doing right now. And that's kind of where I'm at. And it's been confusing. I think she's done it quite a while too. It's been kind of confusing even for the sheriff's department. They try to get the last premium, but people quit and come all the time.
Yes.
And they're our biggest department, so they would have the most difficulty with it.
And I understand the issue. How does this apply across the different elected officials' firms?
They have to follow your EOC.
So is that decision's going to rest with this board?
It rests with this board, yeah.
And this board will cover all the departments?
Because you provide the health insurance and you've been tasked with it. We can basically write it up to what we're doing right now, but I think there's a couple of questions that still come into play if we can't recover the premium within a certain amount, I think we need to back them up based on this. That's where we're at right now. There's not clarification.
So if I could ask, since obviously you deal with it all the time, what is the easiest, most effective way you would think?
I don't remember what to ask.
Oh, Jimmy, tell you what would be the easiest I can tell you.
Yes, tell me, what would, and to get it.
Pretty much what we do right now is if we can't get a hold of somebody or they don't want it, we refund their first premium and get rid of them. So I think the easiest thing to do would be change the verbiage that if you pay, when the month of termination, kind of just deal with termination of employment. The month of termination, if you basically deduct or pay us within, I don't know, 10 days of termination, that will cover you at the end of the month. If we try to contact you and we cannot get that premium from you within 10 days, then we terminate you back to the date of your termination, and we refund any premiums taken for the subsequent month. That means if you quit in April and May. I think if we put that verbiage, it clears it all up. But right now, we're just completely disaligned with this EOC. And we're actually aligned in the favor of the employee, so I don't think we've got any liability out there.
Yeah,
But
that's
I
what I
think we
like.
need to realign it. We've not been taking people off inappropriate. If anything, we've been covering them inappropriately. And with us not being reinsured, it's not really a huge issue. But I think Bob may have a concern. I know there's probably some cost involved, but that's the way we've been doing it.
Well, I just want to make a clarification. What you're speaking to is the termination of an employee.
They quit, retire, or get fired.
But the termination of the spouse is another matter.
If it's a divorce, they're automatically not, it would be the date of the divorce decree. That would not, this is just for termination of employment.
Employee, right?
If the child ages out, according to this, it's supposed to be date of, but Blue Cross actually runs it to the end of the month, so we may need to update that too. That's the way Blue Cross administers it, because it would be, I guess, exceedingly difficult and expensive to administer it the day of. So we probably also need to clarify the language that if you have a child that ages out, they're actually covered till the end of the month. I think that's correct, talking to Blue Cross. And I think that's pretty much across your whole systems. Our EOC is not aligned with ours on that either. So I think we need one for termination of employment. We need the one for the children aging out, and then I think we need to leave everybody else as written. Because that's what it is, because talking to Blue Cross, for instance, a divorce is automatically non-qualified on all their plans at the date of the divorce decree, pretty much by law. They're no longer an eligible dependent once it's entered into the court system. And I think Eric can speak to that too. I think that's 100% correct, is it not, Eric?
Which part of that?
Of the date the divorce decree is entered into the court, it becomes final and they're no longer a dependent.
Correct.
It's Blue Cross, that's legal, that's everybody's opinion.
Well, just in summary, I heard two things in this discussion. One was that the EOC says one thing, and the county, whether one department or several, is actually doing it a little differently.
Better
And
for
the
the
second thing
employees,
I
right.
heard was that Blue Cross, the way they are administering plans
Are slightly different
is a
too.
little different. My summary is, if you go to court, you need to be following that EOC, period. I don't care what department, whatever.
And I agree with Bob 100%, but right now, what I'm saying is I don't think we have any liability because we cover people past what the EOC states. And we have no reinsurance or any claims involved with reinsurance we're ever aware of. So I think we have no liability, but I'm 100% with Bob. We need to completely align our EOC with our practices in all instances if we can.
So each constitutionally elected officer has their own?
They have their own personnel policy, but the insurance coverage is determined by this committee.
Okay.
Right, I mean,
I
it's
just wanna make
100%
sure
offered by the county, through
have a lot
this-
of
it's different than a
cooks in
personnel
the-
policy.
Cooks
Yeah,
and stuff
that's a great point, I think, is that we're dealing with the coverage only.
Right.
Whatever their operating employee policies are is completely independent of this.
This is just like if we bought, basically you guys are self-insured, so you're doing it, determining your parameters within what's legally allowed, like Blue Cross would be if we bought a policy from them. So if we bought a policy from Blue Cross, they would determine, based on what they quoted us, exactly what they covered and how it's covered. We have a little leeway because we're self-insured, but at the same time, it has to be something that Blue Cross can administer. That's why I brought up like the aging out children or dependents, because that's something that Blue Cross doesn't administer that way anywhere, and our plan actually states that. And I don't even think they could realistically even administer it that way because it'd be costly, dropping them the day of and backing them all up.
I'd have to check,
But it's not done that way anywhere when we talk to them, it's not done that way anywhere. Legally, it can be, but it's not.
Well, it's just important that anytime you deviate from that language, someone is making an interpretation and a judgment. And later on, someone else can call that in question when you deny someone else, and it can just snowball. So you just need to follow the EOC.
That's why I'm asking for the updates to align it with it perfectly.
I'd make a motion to align it with it perfectly.
So,
Whether it's easier or more efficient to do it a different way, let's legally do it.
Yeah, so let me re-summarize
completely in
kind of.
compliance, yes.
So one, for everybody other than a couple instances, we'll keep as is. It terminates the day of. For somebody that's terminating means fired, retire, or quit, then their coverage, if we receive both premiums within, let's just say, I said 10 days. Is 10 days reasonable for us to still be able to cancel if we have? If we receive both premiums within 10 days, we'll cover you to the end of the month, no matter what day you're terminated. If within 10 days you do not give us the premiums, then what we will do is terminate you the day that, of your termination, and we will refund any premiums taken that shouldn't have been. On the divorce, that's based on law, it will continue under the first one, and then for dependents that's aging out children, that they will actually be covered, just as it says in the EOC, except there'll be language put in that says it goes at the end of the month versus the date of. And that should cover all those differences that we've uncovered. Is there any other ones we're aware of? That's the only ones we've uncovered so far.
The only thing I would add is that it's very important that a specific termination date be established for whatever circumstance, because at that point, Blue Cross, who handles your COBRA, is obligated within a certain time frame to notify that person, you don't have any coverage, but you could keep this if you want to pay the premium, and then there's time limits. And then when someone fails, you kind of know about the employee because they're not at work, but like in spouse situations or children's situations, you don't always know what's going on. And if that employee doesn't inform you of that, and then suddenly they do.
So we got 30 days for them to inform, especially, and that parallels the tax language for Section 125 deductions. So basically, if a dependent becomes ineligible, they got 30 days to notify us, and then the Blue Cross will notify them as timely as possible. As soon as we find out, we enter it into the Blue Cross portal, I think that day. As soon as we receive paperwork, we go ahead and enter it, so Blue Cross receives it relatively quick. And what I've seen, once they receive notification, Blue Cross appears to react rather quickly too. But the question is that there is a 30-day variance no matter what for the employee to report.
Right. And they have to, whatever that, after that you go through that process, and the employee wants to take COBRA, they have to pay the premium all the way back to the termination date. They cannot have a gap in coverage. Sometimes that could be a hefty sum of money.
Right, and Blue Cross
if
administers
you
that.
waited too long. So this is critical that these things occur on a timely basis.
And right now, all that's happening. The only thing we're actually, in most instances, extending people's coverage further if we can.
So based on what he's saying, if we have a termination date, but the pay date puts them to the end of the month,
We'll cover them.
so then they initiate COBRA goes back to the
COBRA goes back
date
to
of
date.
separation.
COBRA goes back to the date we terminate their coverage.
So it'll be the end of the month
Right,
cycle.
and if they don't pay us the premium, then within 5 days, I think that's.
So we don't need to worry about any paybacks, we just know that date
The
of separation
paybacks
they're gonna use
The
is
paybacks are on the employee, the former employees, or whatever they are.
based on the termination of insurance, not date of separation.
Right, date of termination of
Okay.
insurance.
Right. That's a
So in other words, if we go to the end of the month and say it was May, they
Well,
were
if,
back
yeah,
in
if
the
we're gonna
June
create a
1.
resolution, I just wanna be correct.
Well, it'll be an EOC change, yeah. But yes, that will still align, because as soon as we are notified, we entered into Blue Cross's portal or insurance portal.
Yeah.
And Blue Cross does our, administers our, COBRA, so, yeah, it works
Based
out
on the
well.
dates that I enter.
Right, so she'll enter, like if it went to May 31st, she would enter termination of coverage June 1st. And they would send back the COBRA notification within a time saying June 1st yours, and you have so long to take, and you have a pretty long amount of time to take it. So in reality, we know what most people do. If they'll go and count up their bills or whatever they have, and if the COBRA costs more, they won't take it. If they do, they do, because there's no longer a penalty for gap in coverage because of ACA. There used to be a gap in coverage penalty years ago, several years ago. I've been around quite a while, I remember when that still existed, but that's not existed for many years, so the gap in coverage and pre-existing conditions are all out the door. So most people won't take COBRA unless they really have to, because it's expensive. But that should straighten up all the issues we're aware of in that ESC.
And how will this be communicated to the departments?
Two things, I think. One is we need to communicate to Blue Cross and change it into printed EOC, put it on the website. And then Annette, based on the minutes that Jessica writes, and we'll get her to go ahead and write those, we'll have her to send a copy of those minutes to all the department heads and ask them to spread it out through the employees.
When they spread it out to the employees, do they also put it in their policies and procedures, their benefit book or anything?
It will be in the EOC. As I'm saying, the coverage of like the health insurance is all related on your EOC. It's not to do with their personnel. The only their personnel policies and procedures can say is you're full-time after so many hours, and they have to provide health insurance coverage after 30 hours for a certain amount of hours a year.
So I see once we pass it down to the department heads and tell them to inform all their employees, but we have the sheriff's office that have all these new employees. So I tell them in May, you know, I'll push it out, but I got all these new employees that never,
This should be done when you enroll people. It should be giving them copies of the EOC and telling them it's online.
is that happening?
I'm not doing enrollment right now. They're saying yes.
Yeah.
I'm assuming so, my
Okay.
understanding.
Every new employee receives a copy
Excellent.
of the EOC documentation.
So right now, they probably just need a copy of the minutes and or the email to pass out the EOC to Blue Cross gets a chance to change them. So we'll try to get that out as soon as probably today or tomorrow.
Okay.
And since we're covering them better than what's currently existing, I would say there's not really a liability issue of timeliness until we initiate that change. And I would say maybe the committee needs to give, I don't know, to the end of the month, or what is this? To the end of the month before that change becomes effective. That way there's enough time for all the departments to pass it out to their employees. That's what I would say, because we're giving better than spelled out coverage. So if possible, could you make your motion for that to become effective the 1st of June? Starting the 1st of June or last day of May, whichever one's appropriate. So move.
I so move. So we have approved the change in termination of benefits to agree with the EOC as stated.
Well, the new EOC,
The new, yes,
effective June 1. That'll give time for all the employees to be notified.
June 1st. And when the employees are notified, can the commissioners be notified also?
Yeah.
Sometimes we are notified as employees.
And copy you on the email.
Yes.
Mhm.
And can I also get a copy of the EOC policies that the new employees receive when they come in?
It's on our website, but I'll send you the link.
Thank
Or
you.
I can print you one off either way.
I think it's on finance and on HR's website. It's at least two places.
Yeah, yeah.
And I apologize, I sometimes get lost in our
You want to come up after
websites.
the meeting, we can get those to you.
Thank
Yeah.
you.
And it's on, and I believe you can ask Cheryl, she's back there. I believe it's on HR's website also.
It's on both websites.
That's what I was
And we do have
understanding.
hard copies, so we can provide you with actual hard copies so that you can physically have them.
Thank you. Excellent. All right, we move to new business.
The fiscal year 2024 insurance rates, and let me pass out two items that'll kind of show you, because I know you're gonna want some idea of what the current rates are, and, let's see. We got enough copies?
I'm gonna go.
I made 5, there's only
I
3
give
committee
the-
members.
Did I give it to committee
I'm gonna give one
members?
to Eric.
I think I had another copy for Does everybody get a copy?
Yeah,
I just need one to
Fine.
read.
Okay.
no, you can have that.
There should be
yeah.
one more copy. I have a copy right here, so this is the other copy. That's why I'm one short. He didn't get a copy.
Two new copy. Do you need a copy? You got a copy.
The first sheet here, and I know it's got a lot of numbers on here, but if you look at the very top, the first one says individual cost. If you go across the top, and it's got 80%, 20%. The 20% is what the employees pay, and the 80% is the county. What's built into next year's budget based on the actuarial is these rates here, plus a 1% increase for the county employees. And I'll show you the financials in a minute, the way that makes those look based on the actuarials and our census. Item number 2, if you go right below it, that's in your enhanced dental. Same thing, total cost, 65 county, 35 employee, and just the far right is just telling the amount deducted per payroll. We have 2 payrolls a month or every 2 weeks. These right here, based on the actuarial, I'm recommending no increases because we're actually overfunded right now, because dental's actually decreased in cost. Does anybody have a question about these? About what they will look like? I know we haven't updated them yet, but until we get approval, we usually don't update those. But it would just be the top +1 and then the dental as it exists.
And this takes effect July 1?
Yes, it'd be July 1. And these are the budgeted items. If you take, so let's pass all these out now. It will show you, this is what it's projected to look like in the health and dental fund with those changes enacted.
Is this typo on here where it says effective July 1st?
No, this is last year, this is the old one's not updated yet.
Okay.
That's why I'm saying we don't update these until, this is what it currently is. This will be changed to July 1, 2023, and that'll be increased by 1%.
Okay.
Right there, this is the current one that we've got enacted right now. This is out of the budget document that was given to the budget committee. It has built in for, the first one is your health insurance, and it has your built-in 1% increase. The 2 numbers to look at that's very important, and it's got the revenue and expenditures behind it, but they're summarized on this page. The 2 very important numbers are, if you look up here on the 23-24, which is the 3rd column from your right, if you look right here, it's saying at the beginning of this year, we're estimating somewhere around 15.6 million, which is probably low, it's probably more than that. Estimated reserves in that fund. At the end of the year, based on a 1% increase, we're looking at 15.6 still, 15.572, which is a $8,000 variance from exactly equal. So that's with the 1% increase, that's the estimate that this fund, and those are conservative numbers, we're probably gonna pick up funding again. As I'm saying, if for some reason you do have a bad trend year, we do have adequate reserves. And this is based on the Blue Cross actuarials and the actuarials for your clinic and the small amount of local costs that we do have. Now, there's the second ones are just your revenues and expenditures, that this gives you details of premiums and the expenses, but they actually bleed into this first page that you have right here. The second one is with a 0 increase. This is actually your dental. And it'll say dental on the front. It's about 4 pages back. It has your balance sheet. Same thing if you're going 3 columns from your left. The 2 important numbers are the 1.19 million. And if you look on the bottom, the 1.273 without any increases. So you're looking to pick up a fair amount of reserves without any increases in the dental. That's why I recommended no increases in it. Our dental plan's been running well for several years now. And that's what I recommended to the budget committee, and that's what's built in the budget. But unless there's something different, I'm just asking for the approval and recommendation for those premiums from this committee.
I so move.
Second.
Item pass. And the budget committee was okay with this, correct?
Yes, they didn't say anything about the insurance rates. 1% is very low, and I have historical. Historical rates to kind of tell you historically. We've got a really good year. This year 1%, last year 8, the year before 7, the year before that 0, 5, and then you had 0 for 1, 2, 3 years before that. So you've had quite a few good years. Before the wellness, I think that was the last year we had like a 10% increase, and that kind of spurred the wellness plan on. So your wellness plan's been very successful, and if you notice, the 2 biggest years we've had recently, the 7 and 8, involved around COVID too. So I think it actually skewed us up somewhat. We would have had better years, but if that answers.
The next item is physicals for the Sheriff's Department and the ECC.
Do you want me to give you the history of kind of what I found out about this?
Yes.
I was contacted, or actually our department was contacted by ECC, which is their consolidated dispatch, about doing employee physicals. And they wanted the county to approve buying a device, I believe to do hearing checks, and it was about $10,000, is that correct?
No, it was $1,500.
$1,500, okay.
Yeah, really.
But the 2, I was thinking it was more than that, I got the 10, but But either way, my first concern was we only paid 32%, was my initial concern of ECC for buying equipment. And then my other ones came about and is how they found out about the physicals and why they were asking. Because really, what they were asking to do is pre-employment physicals, which aren't employees yet. And number two, some of them never use our health insurance. Looking at it, we found out that the sheriff's department's been doing it since 2009. We're probably not talking about a lot of cost, but because we're really commingling in with health insurance and with employee premiums, my recommendation is that if they're gonna use them that way, that we probably need to be billing the departments those aren't real true employee insurance costs, especially for non-participants that never participate, and especially for employees that aren't yet on our plan. I know it's kind of a small amount, but I think it's probably, and Bob may remember, but I came in '09, they said, talking to the chief deputy, he says it's been going on since pre-2009, and I don't know when it started. And I didn't even know that was really going on, and I think it went on to one-to-one, care here, and it looks like it got passed to one-to-one, but my concern is, and Eric may have a different take, is since we're really telling employees they're paying 80/20 and paying it through a health insurance fund, we probably don't need to be doing those physicals without recovering the cost. And he may have a different take on it.
No, to me, it's like the acquisition of property. I hate to minimize it to that, but that's an expense outside of this plan.
That's what I'm thinking too, and it needs to be billed back to the departments. Wouldn't be significant, but.
Can I share something quickly?
Okay.
Okay, so, one, it would be kind of hard for us to bill it back to the
Okay.
employers, because you all pay for the staff, you and the Board of Education, it's a shared contract, right? The Board of Education pays 86% of the charges, you guys pay 14%. But we're already paying for the clinic team to be there for you all and for your employees. We do this at a lot of other places as well, because it saves the employer money, right? It's a cost that they were gonna have to incur somewhere else, and they're already paying for our team to be there. So it's completely up to you, and we can do whatever you want. If they wanna pursue it, and we would bill back some kind of charge for the physical, obviously they could pay for the machine if they wanted to do that, but,
Are they
we
doing
could
blood
take
work
like
too?
we could take an average cost per visit and come up with what that dollar might look like and bill it back.
Are we doing blood work and everything on them?
No, they just come in and it's really like a physical, mental health.
So it's really, they just take up slots that could be, okay.
But we're not running at 100% utilization, so it's not like you don't have the capacity. There are times of the year that are busier, right, and times of the
Right.
year that are slower.
As I'm saying, it's something that really shouldn't be commingled, it's probably immaterial, so the question is,
That's my only hangup is employer, not employee. As far as budgetary or the cheapest way to do it, I'm not throwing a dog into that fight. It's just the distinction between status of employment.
and we're, charging
But it's a
employees
requirement
28.
for these people to be an employee, right? Like you all are required
Well,
that.
It's still pre-employment.
And some of them don't
But
take health insurance.
You guys are, not you all, right, not this committee, but somebody in the government is paying for them to go somewhere else for that physical, I'm assuming.
I do not know that.
But the thing we're looking at is we're making it's actually supposed to operate like a health insurance plan. We're charging employees 20/80, and these are for people that are not employees yet, and it's also for some of them that are never even take the health insurance. If you're going to the clinic, you're supposed to be taking health insurance, but some of these physicals never even take health insurance. So mine is more of a concern we're commingling the funds, but as I'm saying, she's telling us it's probably relatively immaterial, so it's really up to the committee.
Do you have any idea how many?
ECC, we've never done, but I would say the sheriff's department, obviously, every time of year is a little bit more than not, but maybe just say on average 5 to 6. It's not that.
A year,
Um,
a month, or a week?
per month.
Per month.
Now, I know like back in January, we were doing a lot more for them. I don't know if there was a lot of turnover or what had happened, but it's very minimal.
It's easier not to start, especially if we're starting to talk about buy equipment for ECC and their cost share too.
Yeah, it sounds like
We
it's
only
a
pay
growing.
32% of them as far as their cost.
Is there any other departments that are using the health clinic for pre-screening or anything else that's like that?
Does the schools, do they do the same, or just the
They
sheriff?
used to do a pre-employment physical, but they did away with it a while back.
Why did they do away
Yeah,
with it?
why?
I just don't, they didn't find it really effective, I guess. It's not, some places like manufacturing places that we have clinics at, it makes sense. We need to make sure they can bend and stoop and push and
Oh,
pull,
okay.
but that's really not applicable to most of their jobs.
Is there a legal requirement for the sheriff's department to have pre-physicals, pre-employment?
I have no idea
idea.
what that basis is on, that there may be some requirements for them. I know there would be requirements for them to go to any kind of academy if they proceed on down the path to be a deputy or whatnot, but again, this isn't about cost
I
effectiveness from the
understand.
legal standpoint.
I'm trying to understand why they started it.
But I think what you do for one, you do for all, right? So if we say we're not doing it, then we go back to the sheriff's department and say, we don't provide that anymore. Is that what you're thinking?
I think that's the way we're going with this, legally.
Or we do, you guys calculate an average cost and we just bill the department. It's just probably cheaper than going outside, and we're talking, what, 60 a year, and what would be the average cost?
I'm assuming nobody. from the
$50,
sheriff is
so we're
here.
talking,
I'm right here.
Oh, okay, do you know why? What
I
the-
just know,
the
I mean, I've
screen's
been there
for?
since 2004, and I did it whenever I started.
You don't know what the
I didn't go to
SOP is?
one-to-one, But I mean, even when I applied at Gallatin, I mean, I had to do a physical.
did you,
I mean, they just did.
But you don't know what put it in play here in Sumner County?
No, it was in before
I
I
will
got
say it's
here.
very common for all law enforcement and firefighters to have a physical.
Yeah, I don't
Firefighters
doubt
are
that.
real
Ms.
specific.
Getchie, in 2004, did you go to a clinic or did you have to go
I went to a
somewhere?
clinic,
So they've been doing it for a long time, it's just now, we just weren't aware of it.
but I
This
didn't
is
go
just
to,
a-
we didn't have one-to-one whenever
Had
I
care
started.
here?
Right, we didn't have that whenever I
So
started.
that's what I'm saying, it was passed from care here all the way to, so somebody at some point started the process, and I don't know. And it's not really material, because if we're talking 50, 60 people times $50, it's not a lot of cost, but it's the same question, we probably need to find, if possible, some way to uncommingle that, and maybe the cheapest to let the department just reimburse them for an estimated cost. To kind of
So,
unwind it.
comment in the back, Cheryl.
Post requires, law enforcement post requires that you do pre-employment physicals for fit for duty for your safety sensitive positions, fire departments, sheriff, police officers, EMS. In most places, your dispatchers go through the same process as your police or your law enforcement. Same way with some departments have to do psychologicals. So again, everywhere in my experience from human resources, the department's budget for that money, and it's designated ahead of time because it's a requirement by state or by law that they go through post pre-employment physicals.
So to clarify that a little bit, we would bill the department, but then we would credit that back to you all on the pass-through invoice.
On the
You and
pass-through.
Board of Education together.
That'd be the easiest way to do it.
Okay.
With these requirements, we haven't mentioned the volunteer fire department. Are you saying that they, although they are a separate entity, are they also doing, anybody know if they're, our volunteer fire department is doing this also, or nobody knows, or they're not?
They're not with us.
They're not with you. They may not be doing it at all.
From their,
All right.
Tennessee code.
okay, they gotta have one from Tennessee
Yeah.
too. Okay. Have to
I-
have their fingerprints and then, they gotta have a physical, but the
Yeah.
question is it appropriate to do it for?
I would like to make a
Definitely.
motion that we defer this to next meeting and have legal look into it. I want to make sure that legally, because it is an asset, like you said, of the employees that we are. And if financially, even them rebilling, and if it still might impede on the employee's asset base.
You're talking about the rebuilding or?
Yeah.
Splitting
Just
the
doing
cost
yeah,
differently?
yeah,
I think they get reimbursed.
I
for
don't
cost
think that's
of
gonna be a
it.
legal issue, but the other part would be.
it
for
would be.
sure.
So can you research that for us
Yeah.
and give us a legal opinion? And after the legal opinion, we'll handle the process. Is everybody good with that? I'll make a motion that we defer in lieu of the legal opinion.
For the old business.
Yeah, we'll refer it to old business for our next
Okay,
meeting.
second. Refer to old business.
So we move on to the appeal for coverage. Item C.
I'm not sure if anybody, but
Is anyone here to speak to that?
there's a letter attached in there. Our understanding is that they're no longer ineligible to depend at the day of the divorce decree. when it's entered into the court. The employee or the spouse has 30 days to report it to us. As soon as they report it to us, we terminate on Blue Cross, and then they they send out the sheets. That's our understanding. Talk to Steve.
Legal, do you
Steve, that's
concur?
his.
I'm sorry, I was jotting down notes from the other one. What was that now?
They're no longer dependent, the date of the divorce decree, the date the decree's entered
Oh,
into
yes,
court.
I agree with that.
And then also, we talked to Blue Cross Blue Shield, their plan works the exact same way, day of the divorce decree. We've actually contacted them directly to make sure there's no misunderstanding. And our EOC says, that right now, basically it all terminates the day of eligibility, so. My thing is, if we do this, I think you're gonna set a precedent where you're gonna put out, then anytime even if somebody has their divorce decree or whatever, that you're gonna allow them to maintain coverage until they're notified, which is gonna be very problematic for Blue Cross to administer, and I think the county. I think that's kind of where we're at on the whole issue right now. And maybe I'm speaking, I don't want to speak for Blue Cross, but that would be very difficult to administer, to cover people until they're notified,
We're gonna term them when you tell us to term them.
which is the date of the divorce decree. And anytime we term them, it takes time to notify people of term, no matter how they get termed.
I motion that we deny the appeal.
And Bob had it.
So, we move the denial of the appeal. Item D, life insurance bid. Do you want to speak?
Bob's got that, he did
Bob's
the
got that.
analysis on it.
Yes, did you all receive, I think we sent spreadsheet,
It's in
Who did you send it to, Bob?
Brittany did.
Who'd you send it to? What does it look like, Bob? That's what we were thinking, that you were bringing it this morning.
Executive summary,
Does it look like this one? Because I thought you were bringing them this morning, get somebody a copy.
looks a little different than this one, because I had made some notes for myself.
I didn't get one.
I anticipated,
If you got one, we can get somebody upstairs to copy it. Jessica can run up and copy it.
I got 6 or 7 copies, is that enough?
Oh, yeah, that's, yeah.
Well, this is being passed around, just some general information. For this trust direction, we sent out an RFP in cooperation with the county for your life and accidental death and your employee assistance program. That went out to several companies. We had a public bid opening and received those in. There were several companies who declined to quote. From what I understand, you folks had a pretty healthy claims year last year on this. So that would cause a lot of companies to say we would just like to hold off, and they did. But we did get several quotes, which you'll see on that spreadsheet. After looking at this in detail, the first thing you'll notice on the where it says one-time employee life rate per thousand, you'll notice the current rate is 11 cents per thousand, and that's based on a pretty large life, what they call life volume. In other words, if everybody died, how much would they have to pay out? So they take that rate times per thousand of that volume. That's how they come up with your premium. And that life volume is like $36,501,000. So that's the total, their total possible exposure. Okay, so based on that, and then looking at your loss ratio, last year you was paying for that basic policy, you was paying 11 cents per thousand over on the far right. And then you'll see another number under that of 3 cents, which is for the accidental death additional benefit. And I just looked, that accidental death rate hasn't changed in 7 years. And then the first number is what we look at. That's one of the first places we go in addition to comparing coverage. And our first choice would have been to accept Kansas City Life's quote. which would have been, that's who you're with now. But you can see that their increase was $0.015. It's kind of like the property tax rate, don't y'all talking like pennies or whatever? It doesn't sound like much, but
It's a
when
lot.
you multiply that times 36 million, it starts being real money. So that would have been our first pick. However, in going through the quotes in detail, we noted that the agent who submitted this, who's the current agent, made a human error in his reporting or what he gave us. And we've spoken to him about it just to make sure we understood and were accurate that we did not have it. There are general conditions that they had to answer, and then there are bid or RFP specifications they have to answer. It's two different documents. And he just printed 2 copies of the general condition page and didn't print the RFP page. So based on that, it is non-conforming because in your RFP specifications, general conditions 22D says to the agent, you understand that Sumner County reserves the right to reject any and all proposals, to waive any and all informalities, and the right to discard all non-conforming and non-responsive or conditional quotes. It also says in 22G, you understand that Sumner County may reject all quotes submitted and call for new ones. So we consider that quote, although it's the best one, to be non-conforming, and so we're not going to attempt to give you a legal opinion on that.
I agree with Bob, we can't take that one.
Yeah,
Because
and
they asked me, because on the very front page, it says any of those in blue,
Yeah,
you will be disallowed, but it does give us the option to take any nonconformity, but when I look at that general sheet, it's necessary to know what he actually bid, and it just had some of the details in there. So I wouldn't agree that it's something that we could waive.
well, I have down here what your choices are. The first choice would be to forgive this omission since other responses in this proposal confirm the major aspects of the cost and coverage. In other words, you could, from other submitted documents, you could confirm that, but right below that, we have typed not recommended
And I agree with
because
Bob.
it could be questioned. So now, where does that leave you? So let's talk about the other two. One other thing, a second one, then I'll get to the third one, which would be our recommendation. The second thing is to reject all submissions, which I just read to you up here. You have a right to do that. Just reject everything. And accept the normal renewal, assuming it will be identical to the RFP submission from that company. Keyword assuming, okay? So you do have the right by the language in the release to just reject everything, and you're back to zero, okay? At that point, they still have to offer you a renewal. They would have if you hadn't put out an RFP, right? But maybe the rate would have been different, okay? So, the advantages to doing that, if it was an option, you'd save $2,190.06 compared to the next lowest rate through US Able. And you would also remain with the current carrier with no possibility of administrative errors in changing companies. Anytime you change companies, there's a possibility of some input missing something, and it almost always gets cleared up, but it's always a hassle, and especially if it includes a death, because the family is devastated anyway. So those are the advantage. The disadvantage is that the decision may be challenged.
I think in reality, you wouldn't be doing a bid. If we kicked out and you have conforming bids and we have several, I think in reality, what we did is destroyed a bid and had no bids at all. I think our only other option would be if we completely rejected them, is to go back and rebid it, and there's not time.
We don't have time for that.
I think that would be a good option, but I don't think rejecting them with conforming bids, even though our RFP, because our other ones allow that in the county, is something we don't do because you've got the argument there's multiple conforming bids now.
So let's talk about number 3, and that's to accept the next lowest bid through US Able. Let me give you a little background. This rate on here, you'll see there are two quotes for US Able. The only difference in those two quotes is that one's for 24 months rate guarantee and the other's for 36 months. Actually, the less expensive one is the 36 months. And I can only ascertain that that's because they feel like they'll keep the business another year, so they'll give you a better rate. It kind of sounds like it ought to be the other way around, but when you think through it, that'll help you figure that out. But if you look at that lower rate, the first column on US Able is 13 cents, and your the renewal quote from Kansas City's 12.5. That's a half a penny, right? Difference in those. The AD&D is the same rate. The other thing, if you'll come down through there, both the Kansas City and US Able have the EAP in there. It's included at no charge, or at least it's built into the rates. And the difference between Kansas City's renewal at $67,891 and US Able's quote of $70,081 is $2,190.06. So if you take this over the Kansas City option, it is an additional expense of real money at $21,906. So
A lot of internal work too.
the advantages to doing this, oh, there's one other big difference, and I may have failed to highlight it on your sheet. Under that first column, US Able, down at the bottom, it says on EAP company, there are 6 visits per issue. In other words, whatever kind of medical issue the person has, they can have 6 visits per issue. Currently, you have 5, and the renewal is 5. So this is actually a better coverage. It does improve the coverage if you go there. And that's really the increased cost from $2,100, $2,200 around it off, is really the only disadvantage to doing this. Now, there's one other issue you've got to decide. This US Able quotes through 2 agents. Let me go back and read something out of the specs for you. General condition 20 in the RFP says, proposers understand that if RFPs are submitted from the same insurance company or through 2 or more different agents, and that insurance company is chosen as the winner, the county will determine, based on qualifications, which agent wins. And we would offer that we have worked with both of these agents. They both are very capable of taking care of this and servicing the account. So the one thing that I would point out, something I pointed out up above, you would be changing carriers, which means some paperwork's got to change, beneficiaries have got to be transferred. There's a lot going on there that'll have to take place. It may make sense to retain the agent that you have now, who is very familiar with that account, to take you through that process.
Pat Boyd.
Yes, that's.
I've worked with both of those, both of them before for several years.
So
Yeah,
did Pat Boyd change companies?
No, he's a general agent.
He's a general.
Yeah, he
'Cause
submitted through, as Jim did, through several
Understand.
insurance companies.
Jim's at the meeting right now.
And totally, we're looking at, I don't have it in front of me, but probably, they went to like 20 different companies. So we had, like I said at the beginning, we had a lot of folks just, not right now. We don't want this business. So, and you can see, if you'll just glance at the other rates from the companies who did quote, they are quite a bit higher. And there are some issues like on security, there's no EAP included at all in that quote. And then Dearborn came in at considerably higher than the others. So you can see what's going on in underwriting with these companies on this account this year. And one last thing I'll point out, you have had this 11-cent rate for the last 3 years with Kansas City Life. The year prior to that, the 3 years prior to that, you were with US Able at 14 cents. So you're still not back to where you were in 17, 18 year. So all those years we've managed to keep this below that change that we made in 2021. Are there any questions, clarifications?
I think you did an excellent job of explaining it. Thank you. And I completely agree with the lack of the RFP in the situation we could get into. It costs us a whole lot more than the difference in cost. I would just have to ask the law director, you concur legally?
We went through my office for purchasing, and I mean, that's where it goes, and that's when I told Bob, they asked me if I would give because it actually on the RFP allows me to give what's it called? A variance, is that the best way to wait with Bob?
Mm-hmm.
But my thing is the actual blue sheet was noted on the front sheet that it would be disallowed, but you could still give a variance, but when I started looking at the sheet, it actually had terms that makes the bid as part of the bid. As Bob says, you could almost, from his other two bids, guess what he's gonna bid, but it wasn't a complete bid. If it would have been something like the general terms, it may have been okay, but I'm 100% with Bob, but they're the one that asked me, and I was not for doing it that way or in agreement. And then the other one completely disallowing it with conforming bids, you don't have a bid at that point.
Yes. All right. Bob, your thoughts?
Well, the fact that Pat Boyd is in both of these areas, looks like that would be the easiest way to probably go about. You know, I figured he could just take the form, then all you need is a signature after that.
No. No, we're gonna have to my understanding is, we have to else US Able is going to honor them, or we're gonna have to do them all no matter which one of them we get. Of course, there are US Ables and Kansas City Lights forms that won't really bear on, it's my understanding, and Bob may say something different. Basically, your broker is not going to have any bearing on if we have to change the sheets.
Yeah, I know, but they're familiar with both firms is what I'm saying, and therefore, when switching the companies, they would be able to know the difference, be able to provide something a lot easier than if we wanted somebody like Jeff Barrett here who has not been doing anything with the employees. It'd be a little bit easier, as far as what I'm looking at. And you mentioned about the error,
The possibility of,
yeah.
we have had that happen, not with either one of these agents, but we've had that to occur. Because the biggest thing the challenge with any life policy is the beneficiary cards. And I don't even think are they even cards anymore? I think it's all electronic.
There were forms and then we submitted them. There were forms.
Yeah, but that's really something that the employers should do, and many do not, is you need to regularly check with your employees and say, do you have any changes to your beneficiary designations? Because people are getting divorced, die, all kinds of.
How frequently do you suggest that we reach out and send out a reminder email?
To cover myself, I would have to answer that annually. I know that's difficult.
You could ask them during the open enrollment. But the thing is, US Able does their open enrollment, so they don't know how willing they'd be to do that. But we've used both of these brokers before. Mr. Malone was our broker, I don't know, probably 6-7 years ago, Bob. And then the current one is Mr. Boyd. And they've both been our life insurance brokers. It's just based on which one gets the lower bid usually, and this time they both got the same bid.
Cheryl?
We just did an update for all of the beneficiaries for Kansas City Life, because when they changed over 3 years ago, evidently not everyone changed at that time. So we just did this not even 2 months ago. The Human Resources Department sent out beneficiary forms, and we collected them for anybody that was hired prior to a certain date.
Okay.
For the changeover. All new hires are coming in and they're completing the Kansas City Life form. So everybody in the last 2 years since we've been here has completed a beneficiary form. And then an updated form was done for everybody again, other than those that were hired after the 2-year mark.
Okay, excellent. So, without disagreement, it looks like we're going with US Able.
Yep.
And so the only thing is between Mr. Malone and Mr. Boyd.
Mr. Malone's here. if you'd
Mr.
like to talk to
Malone?
him. I don't think Mr. Boyd's here, but
Mr.
If
Malone?
I may make a suggestion on what Cheryl just said.
Yes, please.
And she probably already is doing it. When you get that divorce decree, that's also a flag to change the beneficiary. Very important. I have a case that had been divorced 20 years, and the ex-wife got the money, and the current wife that had the children didn't get anything. So that's a very important time to change.
Yes,
Good, I figured you did.
very good. Mr. Malone, do you have anything that could help us make this decision?
May I address the table,
Yes, sir.
or can I do it from here?
Either way you'd like,
Okay.
sir.
Never been one.
You'll look nice on the camera if you come closer.
Oh,
you have a little boogered out here thing, won't you?
okay. Thank y'all for letting me come today. I've been doing this since '94. I love what I do. And I think life insurance is very important to your employees, and I congratulate you for providing. It's the paying off the house of death. It's the education, it's the food on the table. So it's very important to have this, it's very important to have it for your employees. And that's part of our communications and education. When we do your enrollment, get everybody enrolled for you and everything, we'll talk about beneficiaries, and you got an excellent HR department. We'll talk about beneficiaries, we'll also talk to them about wills, and we'll also talk to them about trust. And trust can be very important, and we bring that subject up again, divorces. If you've got underage children, trust can be very important to fund that trust. And I'm open to any questions.
I don't have any questions.
Were you the one that was the agent prior to going to Kansas City line?
I was his agent a number of years ago. I don't remember
So
exactly.
2020, you said 20, Bob, you said
Yeah, I just-
2017, 18 is when the
Yeah,
switch?
y'all were US Able from 2017 to 2020.
So you were that?
Yes, sir.
agent that-
And I'll say this, I'm responsible for USA for giving us a 36-month rate. And when we went back negotiating with them on it, they came up with that 13-cent rate, just like Bob's talking about. They get to keep it for an extra year, but they first gave us a 24-month rate. And we went back and forth a few times and got it up to 36, which was what you were requesting.
Can I ask a question? I'm at the table. Will US Able honor our current forms, or do our forms have to be on US Able?
That's a good question, and I'm not 100% sure. There will be a general contract, et cetera, that we'll fill out, and we'll do that for you to get it. But beneficiaries should be carry over with no problem.
Okay.
And since you just done it 3 months ago, they should all be current. And I would suggest quarterly, just to remind them about beneficiaries, because I've seen people get called on it so many times, and it's a shame. Thank you.
Question at the end.
Yes, sir.
Tell me if I'm accurate, that the employer is responsible for keeping those forms so they can file that with the claim should someone die. So it's
Correct.
important that the employer have that on file.
Yeah.
And it's up to date and accurate, because that's one of the pieces, I guess, of the death certificate and everything else that they send in to get the funds paid.
And part of our job is to help file those death claims. It's not a pleasant job, but it's part of it.
Thank you.
Thank you all very much.
So I make,
We're looking at going with this versus, something that is not non-conforming.
yes.
Okay, well, I mean, rather have something that does conform.
Yes. So I would make the motion that we go with US Able 36 months.
Okay, no second.
And also, I appreciate Mr. Malone coming today. I can speak for myself. Bob and I are, for myself, I'm equally in acceptance of Mr. Boyd or yourself. I appreciate you coming today. So I would just lean your way, I guess. So I appreciate that. Bob, your thoughts?
Same here. Now, is this both kinds of life, or is it just one, term or whole, or what?
It's, I think the contract's just for the group life.
Group?
Yeah.
But
It's term.
it's term, though?
Yes,
Yeah,
yes.
Okay, thank you.
So I make the motion that we go with US Able with Mr. Malone.
Second.
And so it is approved. On to the next item, breast pump coverage.
That one we've got from Blue Cross Blue Shield, and they say we need to take that to remain in compliance with ACA. We'll just bring it for the committee for adoption.
I so move.
Second.
So item passes. We'll move the coverage up to the ACA. Dental EOC.
That was one where we were talking to Brittany. The ACA does not cover dental, but she told us that most employers are paralleling the eligibility requirements between health and dental. If you read your dental on page 30, there's a couple of requirements in there. There's the student requirement, 50% coverage. The student requirement or the 50% general coverage is not under the health insurance. So the question is, there will be a small cost. Do you guys want to parallel them or leave them as is? Because you can leave them as is. And that was just her question, so I passed it on to the committee because she said a lot of employers were lining them up. You may want longer to think about it, put it back under old business. There's no rush on this one.
Okay.
Will you start that over again? You said some, what?
There's like for instance, for your dental,
Okay.
if you read there, it says 19 years or older, 25 years or older for full-time student. That's a different requirement for health. Health is to 26. You can be married and be
Yeah.
on your parents'
So
health
then-
plans to 26.
Dental stops at 21?
Based on, no, it's 19 years old
19, okay,
and up to 25 years old if you're a full-time student.
okay.
And Bob saying that's something you guys probably want to think about. There is some cost there. The plan's been running well, but it will be a potential cost increase if you do it. But a lot of employers are doing that. So my understanding from Brittany and Bob may have a different, she said that's what she sees in a lot of.
Basically what Brittany's analysis of it was, but, it probably wouldn't hurt to wait another meeting, give you time to
Digest that.
absorb that.
Just want to get it on your radar for old business, and that way you can look at it, think about it.
It would be good to make the change before July 1. I don't know if y'all meet again.
Probably not, but
No, we do not meet
I'm
again.
not sure. I'm not sure it affects the July 1 date, though, if we made it.
We can do it, there's some change, we can go back and retro stuff.
Yeah, okay.
So my, well, I
Try
think
not to make you do that.
it would give the committee members time to go and talk to other employers and other people you know to see if they're lining those up or if they're even thinking about it.
How much of an increase?
No, it would be hard to say. It'll just be based on if it pulls dependents in, and the increase also, there's limits on the dental, so it wouldn't be huge. Because you're covered like 2 cleanings a year, a certain percentage, up to a maximum on your ortho. So, wouldn't be huge, but the same thing, it may render an increase next year in your premium you wouldn't otherwise see. And your reserves are strong, just to make sure.
You wanna think about it? You wanna?
Yeah, I'd like to think about it. Motion to defer, and then, as he said, they can backdate it. I make the motion,
Second.
so we approve to defer the dental EOC until next meeting. Item G, one-to-one update, did we not?
They sent me an email, and it was about a program they wanted to offer, and I thought it was probably for them just better to go ahead and show it to the full committee to see what they're wanting to offer.
Ms. Ashley will talk about it. I've got another handout for you guys to take a look at.
So we spoke to the Board of Education about this too, because obviously it's shared contract, shared costs, but we talked about looking at putting on-site x-ray at Ellis Clinic for a variety of reasons. One, Ellis is kind of a central location, but two is obviously our biggest location with the most space. So upfront costs would be around $80,000 for a one-time purchase of the equipment and upgrading some of the walls that need to have lead in them to be within the correct parameters to have x-ray. Of course, there's a split, so it would cost to you all be around $11,000. So this will do a few things. One, it will be able to drive more patients to the clinic, which the more folks use the clinic, the better off it is cost-wise for you guys. But two, it'll also help us refer your employees to the right ortho, if ortho's even needed. So oftentimes, people are going to urgent cares or emergency rooms to have x-rays, and really it was just a rest ice kind of a situation, and then you have an ER bill or an urgent care bill on top of the x-rays. So the hope is to save money, but then also get your employees healthier, quicker, and to the right place when needed. Outside of the initial cost to add the equipment, it's $8 per x-ray, so we don't staff a radiologist, we send that out to a radiologist who reads them and gets them back to us quickly. And then as far as the technician to perform the x-rays, we already have medical assistants in our clinic, and oftentimes you can find medical assistants who are x-ray certified, so that really wouldn't be any additional staffing cost to be able to offer this service. Questions you guys have for me?
So the school already agreed to their share of it?
And this
And
is just,
so, I will say, I'm sorry.
this is just for one clinic?
Right now, yes. Eventually, maybe it would make sense to put it in the Portland Clinic also, but we wanted to start small, get the utilization going, and then grow it if we see fit. With the Board of Education, and we've asked for this from Brittany, and she's working on getting the information, but we have a tool that we can access their claims data, and so we know within the first year, this will pay for itself, just in what they're paying for claims and x-rays. I would say it's probably gonna be similar for you guys. It would probably pay for itself in the first year, but we're working on getting that information to be able to prove that.
What's the life of the machine?
The warranty is 5 years, but it should last much longer than that. And it's digital x-rays.
So the $70,000 for the machine and equipment, is that our 14% share?
No, your 14% is $11,200. That's the total cost.
That's what I was wondering.
I got a question. So ideally, for this to be effective, you need to send it to a radiologist to get a response so you can administer.
No, our providers order the test, so anybody can order the.
I understand that, but you've got a patient in lieu of sending them to an orthopedic place or some other facility, it would be dictated by what's read on that, right? So what's the turnaround on that?
So the commitment is 24 hours, but if it's something stat, they'll get it back to us within a couple of hours.
So it's still, the patient's going to be leaving the facility probably not knowing anything yet?
I mean, if the break is severe enough, they're probably not coming to us to begin with, right? If they have a bone sticking out, they're probably going somewhere other than one-to-one's clinic. But typically, anything we can stabilize, treat the pain, that kind of thing, and avoid some unnecessary costs, sending them somewhere else.
I can urgent care, how quickly do they turn around on that? I don't know.
Madam Chairman, well, Madam Question.
Oh, I'm sorry, Bob. I was busy thinking about cost and life of machine, sorry.
Yeah, I
Instead of
appreciate
running
that.
the meeting, I'm sorry.
Yes. Actually, two questions. Is this 70,000 including maintenance? I imagine these things have to be calibrated, checked, fixed.
They really don't. So we have a couple in other clinics, and they really don't require a lot of service or maintenance. Now that they're new digital technology, I think the older ones probably did. And I would need to look at the quote and see if there's any maintenance built into it, but
Yeah, just trying to see what the,
yeah, we have had no issues, and we've been running them for 3 years in other clinics.
it's like a car cost X, but you have to service it. And if you're gonna budget something, you need all of that. And the second question, you were talking about how it would pay for itself. Do you have a comparative one X-ray retail cost to go get that done? Do we have that?
I do. I don't want to make something up, but I can look it up for you, yes.
I just think it's important that if we say, this says the cost for reading X-rays is $8, but the total cost of that visit, that technician's time, you know, what does it cost for one visit to get an X-ray and get it read and get a report compared to retail? If I go to TOA, what does that cost?
Right,
for
because
that
TOA,
same
you're
thing?
paying for the visit there, and you're paying for the X-ray.
Right, I'm a regular customer, so.
How
Me
quick,
too, unfortunately.
how quick is their turnaround down at TOA though? Like if you go in for an X-ray, how quickly do you get it back?
Oh, it's like a day, maybe.
So we're pretty comparable then.
Yeah, and so again, they're digital X-rays, so our providers will be able to look at them. And most providers, doctors, they can read X-rays, but not to the level that a radiologist can, right? So they'll be able to quickly look at it and say like, oh, I think you can wait until we get the final read, or we need to send you on somewhere right away. But to get a final official read, it's 24 hours or less, depending on how we order it.
Has it been successful in the other ones where you just put it for 3 years?
Yes.
So it's got high utilization?
Yes. We've avoided quite a few ER visits for people who've fallen and hurt their ankle and ran right over, and it wasn't anything.
And I have the same question that I had with the machine and equipment. The 70,000 you said is in total. The additional cost for construction, the 10,000, is that the total, or is that the county share of the construction?
That's total. All
That's
that's
total.
cost.
Perfect.
So, yeah. And it could be a little less. Typically what happens when construction needs to go on at the clinic is the Board of Education and Maintenance Department will do it themselves, so it's as minimized as possible.
And
I'm sorry, I didn't hear your question. Was that asking, is the same percentage applied to the construction cost?
Yes.
So what's our construction cost again?
It is.
Yeah, so
10,000.
the total is $80,000 estimate, and you guys would be 14% of that's $11,200 total for construction and equipment.
Okay, that's everything.
Yeah. And the other thing too we should probably look at is there's like $5,500 worth of tax in there, and I think if the Board of Education bought it or you guys bought it, y'all are tax exempt. So
We'll have to bid it though if we do.
uh,
Well, so will the Board of Education.
Okay, well.
But I mean, it's worth it for the taxes though, because
yeah,
should bid it, and if you're buying it from somebody, they should bid the same or cheaper. So.
right.
I mean, the Board of Ed's either one of us, but that makes the most sense. One of us two need to bid that.
It would just save some money there too.
At that amount of money, we need to bid it. Anyways, even without
If
the
it went
cost
to them, they
saving.
wouldn't, but yeah. And a lot of times, like a lot of these specialty things, your bids usually don't help, but it will get rid of the sales tax by us or the Board of Education purchasing it, which is a 9.25 or whatever.
I was going to ask you today for possible tours of the clinic so we could get, Commissioner Brown and I could get a better understanding. And I wish we had before this conversation of construction and stuff so we can have a better picture of what's going on.
I would love that.
Yeah,
Absolutely.
so if we could
We'll arrange
get
it.
together after the meeting, that would be great.
Yes.
Your thoughts? Bob?
I guess we'll, if it's Is this a pilot program or you already have one?
No, we already have some. So we have 2 clinics in Hamilton County that have, X-ray, and then we also have one at Lodge Manufacturing that has X-ray. But no, it's been proven at other clinics already.
And we've added a lot of stuff to this in the past, if it makes sense, and this one looks like it makes sense.
I mean, would they all be funneled to this one side if they, okay, that's what
For now.
I, if this is something that's necessary for the employees.
Would you have an urgency, would it have like open appointments for that though?
Yeah, we could.
That's my question, is right now you have to make an appointment and they're way out,
Well,
so
we have
you're only gonna have an
walk-in
X-ray machine at one place, how are you guys gonna handle that?
Yeah, and we have walk-in hours at Ellis, so obviously during walk-in hours, anybody can come and have an X-ray if they need it. But yeah, we can be creative with appointments, and obviously, even now, if somebody has some kind of an urgent issue, we work them in, even if we're scheduled school.
Eric brought up, this is in a school?
Yeah.
All of our clinics are in schools.
Yeah.
Oh, I didn't know.
They have a separate entrance in the school.
Okay, what's-
There's separate parking and separate entrance, all of them I've been to, unless some.
That's, you're right.
I've been to 3 or 4 of them. so-
Yeah, you're
I
right.
go all the time.
Yeah.
Yeah.
We used to have a pharmacy several years back, but it didn't end up paying it out.
So I feel that we're going to approve this. I would just ask that when we come back with reports, let us know, we'd like to know frequency of use and
Absolutely.
outcomes.
Yeah, we'll definitely add it as utilization metrics on our reporting.
Excellent. Do we make the motion, Bob?
So moved.
I concur. Item passes. We will appropriate, or, no, send out to bid? Do we want it, do we need
That's
to
where the schools
contact
want
school?
That's where the schools want to bid it, and
How do we
I'll
go
ask
about?
them.
Yeah, ask them which
one
one.
of us two will just bid it to avoid the, unless there's some kind of purchasing cooperative that says that we might buy it from there too, but yeah, that's where the school, either one, just let us know one way or the other.
Okay, perfect.
Okay. Item passes. I make a motion to adjourn,
Second.
so we're adjourned. Thank you for your time.
Discussion on the adjournment.
Yes, would you like to stay and discuss that?
We'll let Bob and Eric stay down here and discuss that.